All right, so this is our video over the EV300. I'm trying to make this short and sweet for you guys, so let's just get into it. First thing you want to do is you want to make sure that it is set up right. So we do use the same tubing as we do on our V60 BiPAPs. Unlike the BiPAPs, this extra pressure line, we do not use this. Go ahead and just take that out, and that can be thrown away because we won't be using that. Up here to the machine, you always want to make sure that you have a bacterial filter. There should always be a bacterial filter connecting to the machine. Now we have started using oxygen analyzers. Some of the Philips machines have been found to give incorrect FiO2s, so we have started to use an oxygen analyzer. Now to get that into the machine, it doesn't just want to fit, so you do need a 22 millimeter adapter. We keep this in our department. So 22 millimeter adapter first, then your filter, and then it plugs in like that. So on startup, this is our starting. So we are currently in assist control, volume control. You will want to hit new patient, pick your patient type. Now this can be used on infants as small as 2.5 kilograms. So this can be used with pretty small babies. For the sake of our demonstration, we will say we have an adult female who is 5'8", 173 centimeters. Hit accept. The cool thing about this machine is it'll do your settings for you. This is just making sure that we are using the bacterial filter, which again we are, so we will acknowledge that. So again, it gave us our starting tidal volume for us. These other settings are more or less standard. The one thing I would change is I do like to start with a slightly higher respiratory rate. We will change that to 16. Now we're ready. Now, something to be aware of is unlike the BiPAP and unlike some of our other machines, this will not start giving breaths until you hit start ventilation. So our BiPAP will sense them breathing and start up on its own. This machine will not. You have to hit start ventilation if you want to begin giving them breaths. I'm going to put it back in standby. So once you get it up and running, one of the things about this machine is that you want a leak. Unlike the BiPAP, where you don't want a leak for any reason, a leak's allowable, so it's not that you can't get away with it on the BiPAP, but on this machine, you're always going to want a leak. You never want no leak. So on an intubated patient, if you're using this invasively, a leak of 20 is about right. Down to 10 is okay. You never want to see it less than 10. And it can go high as well. 30 is fine, 40 is fine. You don't want to see a whole lot over 40 in an intubated patient. But yeah, 20-ish. As long as it's somewhere in the ballpark of 20-ish, you are good. Now, the cool thing about this machine is you can use it if your BiPAP's all tied up. You can use this in non-invasive mode. If that's what you want to do, you will hit your cog wheel up here, which is where you'll go to change your settings. In this case, we are going to, to add a non-invasive, we'll hit add prescription, then we'll hit the cog wheel. And from here, we will select mode. And ST is the same thing as BiPAP. It stands for spontaneous and timed. It means they can breathe spontaneously. It will give them breaths timed if they are not breathing spontaneously. But your ST mode is the same thing as your BiPAP mode. You will select your IPAP, your EPAP, your respiratory rate, your FiO2, and you're good. In non-invasive mode, we want more leak. In non-invasive mode, 40 is considered the sweet spot. You can go down to 30, that's fine. It can even be higher. 60 or even 80 is perfectly acceptable in this machine. Its inner algorithms can overcome up to 80 of leak. Now, let's just say you're using it in either mode and your leak is low. You're using it in an intubated patient and you're only getting a leak of 5, or let's just say you're using it in non-invasive mode and your leak is 20. You're like, hey, I want more leak. Make sure that this little guy is not capped. We don't want this capped. So let's say you uncap that and your leak is still low. What we will do is we will actually add in another exhalation valve. So this is our exhalation valve. We will add in another one. You can see it's got 2 holes here. This is how we add more leak to the circuit. Other problems, sometimes you can have a perfectly acceptable leak and you will start getting an alarm. It says rebreathing alarm. There's a couple different ways we can handle that. If it's being used non-invasively, you can loosen their mask and add a little bit of extra leak in there. You can grab your second exhalation valve and add that. Again, make sure that your pressure lines are not closed. Sometimes people think that these are supposed to be closed and they close them not knowing any better. Make sure those are open. If you've done all of those things and you're still getting a rebreathing alarm, what you can do is you can go in and increase your PEEP or your EPAP. They're the same thing. You can increase that by 1 or 2 at a time. When you do that, you want to make sure you are continuing to watch both their heart rate and blood pressure. Other things to be aware of on this machine, if it's alarming, we've always been there, it's alarming, you just want it to shut up, so you hit the silence alarm button. When you hit silence on this machine, it will silence all alarms for 2 minutes. Some machines, you hit silence and they have, it'll overrule, depending on what's going on, it'll overrule your silence and alarm at you. Not this one. If you hit silence, this will not make any noise at you for 2 minutes. So if you hit silence, we do have a little countdown here. Make sure you don't walk away from the machine while it's silenced. Let's just say that you are ready to unsilence. You can hit that. Ooh, oops. Sorry, I misspoke. Unlike other machines, hitting silence again will not undo your silence button. But it looks like your Okay, yeah, if you click into your reset and click out, it will remove your alarm. I think that's all I've got to tell you about it. I will show you how to go through this oxygen analyzer while we're at it. And most of these work about the same. Turn it on, if it'll let you turn it on. Oh boy. Okay, maybe we're not going to do oxygen analyzer. Well, do you want to make us, can we edit videos together? I don't know.